Okay, hurdles in research ophthalmology in behalf of Dr. Bairwa. He is not able to attend because of some family emergency. I am going to talk about that. Research in the medical field is an ongoing process, and it is very essential for scientific progress. Now, in the era of evidence-based medicine, high-quality research forms the basis of evidence-based medicine. Studies have shown that research training embedded with clinical training programs helps to promote trainage, critical thinking and analysis, and improve the quality of the patient care and facilitate post-training academic output. There is so much hurdles whenever doing the research because of need of proper infrastructure and sufficient fund, along with that dedicated group of workers. The research process requires dedication, time and honesty. In our country, because of lack of healthcare workers, it is not easy to perform the research. And the basic qualities of good researchers include enthusiasm, integrity, experience. Developing countries such as India faces lot of problems for conducting research, maybe due to people don't pursue the research as a full-time job, whereas the fact is that it cannot be pursued as a part-time hobby also. And second hurdle will come across is institutions or department heads don't give high priority to research work because of high volume clinical work, more weightage and recognition of the persons. And third one is clinical scientists find the environment in India is not conducive to perform high quality research because they are not well recognized initially, even though they are working abroad and they think they can do the research in India, but it is not well recognized job, and so they consider as research as a professional suicide, and it is not a lucrative and remunerative as clinical practice. Lastly, research ethics are not followed to the core, due consideration given to all the ethical aspects of research and publication. The barriers to conduct the research for ophthalmologists is due to lack of time, intensive clinical work, lack of mentorship, lack of research training, lack of research skills, lack of research ideas, and not enough impact, and not departmental interest and personal interest, and research is not important compared to the clinical work. And these limitations may be compounded due to inadequate infrastructure and basic training how to conduct the research for postgraduate students. Even though thesis is mandatory to conduct for research, but they are well trained how to do the research. Even though so much hurdles, we can overcome this research hurdles because of so many hospitals in India with state-of-art facilities and well-trained English-speaking peoples, large population treatment, new patients, and good accredited labs helps to enroll compliant subject who can train till the end of the study. India doesn't lack behind good communication information technology capable which are great help in this type of studies. There is easily availability of data entry, analysis and management, and final report writing. There is so much large extent of negative perception of trials in the mind of subject, fast disappointment due to well informed subjects. Before conducting, if you properly counsel the subjects, they will be involved in as a participant in your studies, and it helps to maintain the good rapport with the researcher. Completion research has no meaning unless it is published. Even though the study done by Daliwal et al., there were around 200 pre-papers are published in 2000 in 2000 AIOC, but 33 papers only published in PubMed Index journal. The other possible may be due to lack of quality research presenting in the AIOC. Kumar Guru published a study titled Bibliometric Study of Publication by Indian Ophthalmologists and Vision Researchers in 2001 to 2006 in the IGO. Their conclusions show that hardening trend of nearly doubling of publication from 2008 to 84 in 2001 to 460 in 2006 by the Indian researcher. However, 50% this publication came from only 9 major hospitals in India. A PubMed research of publication by Indian authors and institution 2008 added 16,290 results as against 11,307 in 2005. Means so many publications are come across nowadays. Even though nowadays, to avoid the hurdles of research and to make interest to the professionals, 2009 MCA amendment made to publish research to get promote in their areas. Promotion in the professionals. The scope for research in India is tremendous because of India is a vast country with rapidly improving economy. Nowadays there is so many organization is giving funded for various researches like ICMR, DPT and DST and others who are prepared for your new researches. ICMR has identified the scope of research in ophthalmology and appointed coordinator for various subspecialties. To conclude, India is fast becoming a new destination for multicentric studies. It is time to wake up, educate ourselves with nitty-gritty of research to reap the entire benefit from this favorable trend. A huge potential, we must explore it to the full capacity. Thank you.
Thank you, Dr. Siddharam. Speaking on behalf of Professor A.K. BAIRWA. And now I request Mathur sir for the last comments and note.
So this was a well thought of and well designed instruction course by Professor Arvind Maurya, and I hope the delegates have got their desired benefit, though the physical attendance is not much. This session has been videographed and recorded, and this session will be on the YouTube for the benefit of many more AIOS members in the future. They will get access and they can go through this instruction course at leisure. So all in all, we tried to encompass the gamut of various presentations, right from how to get started, what is the need for research, how to go about making your research protocol, how to publish or go down, like how to publish and perish, and then how to look out for the source of funding for your research projects. So all in all, a very comprehensive instruction course. I hope all of you have got the desired benefit and outcome of this instruction course. Thank you.